Welcome to a brief overview of osteopathic medicine. Thank you for being a very important part of our students' medical education, and thank you for giving us the opportunity to review the merits of osteopathic manipulative medicine and to showcase our students to add simple diagnostic and treatment techniques to commonplace medical problems. This is Treat Day. Hundreds of patients came from up to 100 miles away by rail car routinely to see this man, Andrew Taylor Still, founder of osteopathic medicine. Why did they come? Because he did not practice with the common treatment modalities of his day, nor did he believe in the mainstream medical philosophy that diseases needed to be purged from a patient, sometimes at the necessary expense of the patient with bloodletting, cupping, blisterings, etc. Rather, he sought to present to each patient what he termed a rational approach to illness that included the patient using her or his body's self-regulatory mechanisms as an integral, vitally necessary component of the healing process. The principles that you see here are the foundation of how osteopathic physicians treat patients today. As you can see, each individual tenet of osteopathic medicine was not at all unique to Still. His genius was in combining centuries of sound medical philosophy into a fundamentally different approach to human illness that, above all else, sought to do no harm. From that common sense beginning, Still developed diagnostic criteria to recognize and treat the ailments of his day. This is an example of a diagnostic criteria still widely used by osteopathic physicians to diagnose and treat acute and chronic back pain. Use of this criteria allows a student to identify causes of back pain at specific joint levels through palpation and testing for restriction of motion, asymmetry to palpation, and tissue texture changes. These are done in addition to the patient's ability to localize pain to a specific area. These diagnostic techniques are gentle, not painful, as Dr. Still is modeling for you in this archive photograph. No bone crunching is involved, as you will see when students model these techniques in a few moments. Why is the ability to find asymmetry through palpation and motion testing globally and at each joint helpful? Why do we still teach students how to do this? Well, because we are wired to accept visual stimuli. From these x-rays, you might think that hip arthritis is the cause of all three of these patients' pain. But patient A has good hip mobility on exam despite pain near the hip joint. This patient's pain is actually coming from sacroiliac and pubic motion restrictions due to a short right leg, recognized by a medical student seeing the patient in follow-up for a chief complaint of chronic posterior hip pain that was unresponsive to multiple NSAID drugs. The student requested the x-ray, and on x-ray the short leg was discovered. Since low back and sacroiliac pain are so common, 75 to 85% of the adult patient will suffer an incidence of disabling low back pain in their lifetime that will keep them from doing their activities of daily living or their job for a period of time. And since so many conditions can cause low back pain, some of them serious, some debilitating, and some life-threatening, any tool that can increase our ability to diagnose and treat these conditions can be most helpful to a trained eye and hand. This is why we teach our students these diagnostic modalities. This is a National Guidelines Clearinghouse major recommendation that highlights the usefulness of osteopathic manipulative therapy when incorporated into an exam and treatment of a patient with low back pain. Our students are taught the importance of taking a good history, followed by a good exam that includes all of the standard following components. done that standard exam and thankfully have not found any evidence of hip joint destruction or lumbosacral nerve root injury in a given patient. It leaves you the traditional diagnosis of low back pain from muscle strain. What do you usually do next? Well, the osteopathic student can apply segmental sequencing, which narrows the area responsible for the patient's symptoms down as much as possible, sometimes to a single vertebral segment or portion of the pelvis. This student is modeling a segmental sequencing exam of the thoracic and then lumbar spine, looking for asymmetry of palpation, asymmetry of tissue texture changes, restrictions of motion from one side to the other, and coupling that to the patient's own ability to localize the symptoms to a specific area that is painful. Testing pelvic landmark symmetry, standing and supine. Pelvic motion testing, standing and supine. Testing the sacroiliac joint symmetry and motion. And finally, determining the effects of the patient's arches on stance, posture, and gait are all important. Why? All of the above joint motions just mentioned are integral components of our bipedal gait. Twisting of the thoracolumbar spine that provides torque to swing our legs forward. Rotation of each side of the pelvis to increase that torque and make it even more efficient for us to first swing our legs forward and then backward. This complex motion begins with tension on the right hamstring muscle and then slight posterior motion of the right iliac or innominate bone. Movement is increased by the weight forward thrust of the propelling action, the leg in mid-swing, creating an extremely efficient gait. And finally, human legs can swing freely forward without waddling because the human sacrum rotates forward on an oblique axis each time we seek to propel a leg forward while walking. So all of this complex motion is required for bipedal walking. Much of it is required for stooping, lifting, etc. So much backache due to muscle strain occurs as an accidental misuse of some or many of these muscles. An understanding of gait is therefore an important tool the osteopathic student brings to the diagnosis of low back pain. Your students can diagnose your patients with low back pain at the specific area of injury, whether it be at the sacroiliac joint or the lumbar spine, or the pelvis, the pubes, or even arches, the feet for short leg, flat feet, etc., or even in multiple combinations of the above. The dirty half dozen refers to 6 common areas of restriction, tenderness, tissue texture, palpation changes, all of which we call a somatic dysfunction. These are often present in patients with chronic low back pain where there is no major joint, disc, or nerve root injury, a psoas muscle spasm, a lumbar somatic dysfunction or sequencing restriction of motion that we just showed you, pelvic bone being sheared one direction or another, restricting motion in gait or in bending forward or backward. Sacral shears, restricting motion at the sacroiliac joint further. Short leg or pubic shear. These 6 somatic dysfunctions were seen to be extremely important common areas of restriction in patients who had low back pain without joint, disc, or nerve root injury. A landmark 1996 study of these 6 common somatic dysfunctions showed that in 187 patients with chronic low back pain, 57% had 3 or more of these somatic dysfunctions. Interestingly enough, only 3.7% didn't have any at all, suggesting that seeking or trying to find these 6 somatic dysfunctions in patients with chronic low back pain is a useful tool. Despite the chronicity of symptoms, most patients were suffering more than 2 years before entering the study. 75% were able to return to work or their activities of daily living if they weren't working when they were hurt. Multiple disciplinary treatment plans included osteopathic manipulative medicine, along with exercise prescription, nutritional counseling, psychological counseling, and a reduction in patients' chronic medication use over an average treatment time of 6 months. The osteopathic manipulative treatments used most commonly to address these 6 somatic dysfunctions in patients with acute or chronic back pain are respiratory assist of a sacroiliac joint for a patient with chronic low back pain, as this student is modeling for you currently. So you can see a very gentle technique that seeks to simply rock the sacrum back and forth in a rhythm in order to help restore motion of the sacroiliac joint. Balanced ligamentous tension of a restricted pelvis, causing sacroiliac restrictions, pain, or low back pain, is also a very simple tool that this student is modeling for you now, where motion of the pelvis is augmented in order to relieve restriction that was diagnosed as being present. Release of anterior spinal ligaments that's associated with chronic low back pain is another gentle way to restore motion to the low back, reduce pain, and improve patients' ability to do their own activities of daily living. Muscle energy is the most common osteopathic manipulative treatment used by osteopathic physicians today. This student is modeling on the patient a muscle energy technique of the dorsal spine. Again, another gentle technique, this one being done with the patient's assistance, using targeted isometric contractions that release spasticity and reduce pain. Adding structural testing to your physical exam reduces liability through better findings and documentation. Techniques demonstrated today are the norm, not the exception. They're gentle, they're soft tissue, they carry no real risk of injury, and they improve patient satisfaction. Most importantly, no bone crunching at all. It's not just low back pain. Students know simple nasal, otic, or sinus techniques to clear congested sinuses and eustachian tubes and upper respiratory illnesses, sinusitis, and otitis. A simple, gentle sinus massage that osteopaths began using 100 years ago is still used by contemporary osteopathic physicians and students to augment antibiotics where indicated. This simple technique relieves pressure associated with rhinosinusitis and sinusitis. Patients begin to feel relief immediately and seek treatment again with subsequent illness. It takes less than 5 minutes to perform gentle drainage techniques that reduce the pain associated with otitis media. This technique couples gentle traction of subauricular tissues with torque of the otic canal to clear the eustachian tube. And lymphatic head and neck drainage can further facilitate drainage from otic and sinus areas. Very gentle vibratory massage of ventral structures as seen here, and thoracic outlet as seen here, promotes lymph node drainage and further reduction of sinus and otic congestion. In asthma, pneumonia, and COPD, gentle rib raising to encourage normal chest excursion, mobilize mucus and promote cough, and increase lymphatic drainage are all in the osteopathic student's toolbox. This student is demonstrating diaphragmatic release to improve excursion of chest inspiration and expiration. Pedal pump is also a technique that can be done to accomplish the same goal. And finally, this student is using a manipulative technique to address a patient with gastroesophageal reflux disease, and then in this patient with irritable bowel. If you wish to learn how to do any of these techniques, we would be glad to set up time to show you how each of these are done. And of course, osteopathic medical students are a resource to explain to you what it is that they are doing and why. So use our students. They are eager to share, and they're eager to learn from you because they know that they have much that they can learn from you. Thank you very much.